Have you ever experienced an ingrown toenail? If so, you understand how painful it can be when the edge of a toenail grows into the surrounding soft skin. While this issue commonly affects toenails, fingernails can also become ingrown. Causes of ingrown toenails. Ingrown toenails can develop due to several factors, often causing discomfort and potential complications. One common cause is wearing shoes that are too tight, narrow, or high-heeled, as they exert excessive pressure on the toes, leading to improper nail growth. Another contributing factor is improper nail trimming, particularly cutting nails too short or rounding the edges instead of trimming them straight, which encourages the nail to grow into the surrounding skin. Additionally, nail injuries, such as stubbing a toe or dropping a heavy object, can increase the risk of ingrown toenails. Some individuals may also have a genetic predisposition to naturally curved toenails, making them more prone to this condition. Poor foot hygiene, excessive sweating, and fungal infections that cause thickened nails further contribute to the problem. Moreover, certain medical conditions, including diabetes, obesity, and poor circulation, can make individuals more susceptible to developing ingrown toenails due to impaired healing and increased sensitivity in the affected area. Symptoms of an ingrown toenail. An ingrown toenail can cause significant discomfort and lead to complications if not properly managed. One of the most common symptoms is persistent pain, tenderness, and discomfort along the edges of the affected nail. The surrounding skin often becomes red and swollen, accompanied by increased warmth in the toe. As the condition progresses, individuals may experience difficulty walking or wearing shoes comfortably due to the pressure on the affected area. If left untreated, an ingrown toenail can worsen and develop into an infection. Signs of infection include the formation of pus, a watery discharge mixed with blood, and an increase in redness and swelling. Additionally, a foul smell may emanate from the infected area, and the skin around the nail may begin to overgrow, further exacerbating the condition. Prompt treatment is essential to prevent complications and alleviate discomfort. Home remedies for treating ingrown toenails. If there are no signs of severe infection, treating an ingrown toenail at home can be an effective way to relieve discomfort and promote healing. However, if an infection develops, it is essential to consult a doctor immediately. At the same time, 14 powerful home remedies can help manage ingrown toenails and prevent complications. Number 1. Warm water soak. One of the simplest and most effective remedies is a warm water soak. Soaking the affected foot in warm water helps reduce pain, swelling, and tenderness while softening the nail and surrounding skin. To do this, fill a small foot tub with warm water and add mild antibacterial soap or Epsom salt for additional benefits. Soak the foot for 15 to 20 minutes, repeating the process 3 to 4 times a day for relief. Number 2. Cotton wedge method. Another useful technique is the cotton wedge method, which helps lift the nail above the skin to alleviate pain and promote proper growth. After soaking the foot and drying it thoroughly, use a sanitized pair of tweezers to gently lift the affected nail. Then, place a small rolled-up piece of cotton or dental floss between the nail and the skin. It is important to replace the cotton after each soak to prevent infection. Some discomfort may occur initially, but it should improve over time. However, avoid forcing the cotton deeper than the swollen area allows. Number 3. Epsom salt soak. An Epsom salt soak is another effective way to soften the skin and release the ingrown nail while reducing swelling and inflammation. To prepare this soak, fill a foot tub with warm water and add 1 tablespoon of Epsom salt. Soak the foot in the mixture for about 20 minutes and dry it thoroughly afterward. Repeating this process 3 to 4 times a week can help manage symptoms and encourage healing. Number 4. Apple cider vinegar. For those looking for a natural remedy, apple cider vinegar can be beneficial due to its antibacterial and anti-inflammatory properties. This can be used in 2 ways. The first method involves mixing equal parts of raw, unfiltered apple cider vinegar and warm water in a tub and soaking the affected toenail for 20 to 30 minutes before drying it well. Alternatively, a cotton ball soaked in raw, unfiltered apple cider vinegar can be placed on the affected nail and secured with a bandage for a few hours before removal. Number 5. Hydrogen peroxide soak. Another option is a hydrogen peroxide soak, which serves as an effective antibacterial agent to reduce the risk of infection while easing pain and swelling. To use this remedy, mix half a cup of hydrogen peroxide with warm water in a small tub and soak the foot for 20 minutes. This process can be repeated once or twice daily as needed. Number 6. Essential oil treatment. One effective approach is essential oil treatment, which utilizes the antibacterial and anti-inflammatory properties of tea tree oil and lavender oil. To use this method, mix a few drops of either essential oil with a carrier oil like coconut or olive oil. Then, apply the mixture to the affected area using a cotton swab. This process should be repeated 2 to 3 times daily to help reduce swelling and prevent infection. Number 7. Aloe vera gel. Another soothing remedy is aloe vera gel, which has natural anti-inflammatory and antibacterial properties that can help relieve pain and promote healing. Extract fresh aloe vera gel from a leaf and apply it directly to the ingrown toenail. Let it sit for 20 to 30 minutes before rinsing off, and repeat this process 2 to 3 times daily for the best results. Number 8. Turmeric paste. Turmeric paste is another beneficial remedy due to its curcumin content, which has anti-inflammatory and antiseptic properties. To prepare this treatment, mix turmeric powder with a few drops of water to create a paste. Apply the paste directly to the affected area. Let it sit for 20 to 30 minutes, then rinse it off. This should be done twice daily to reduce swelling and pain effectively. Number 9. Baking soda paste. For those looking for a simple yet effective antibacterial treatment, baking soda paste can help fight infection while also softening the skin. Mix baking soda with a few drops of water to form a paste. Apply it to the affected area and cover it with a bandage. Leave the paste on for an hour before rinsing it off, and repeat this treatment twice daily to see improvement. Number 10. Lemon juice. Another natural antiseptic remedy is lemon juice, which helps prevent infection and soften the skin around the ingrown toenail. Simply apply fresh lemon juice to the affected area using a cotton swab. Leave it on for 20 to 30 minutes, then rinse it off. This process can be repeated 2 to 3 times daily to aid in healing. Number 11. Garlic compress. A garlic compress is also an excellent option for reducing infection and pain, thanks to garlic's strong antibacterial and anti-inflammatory properties. Crush a garlic clove and mix it with a few drops of olive oil to create a paste. Apply the paste to the ingrown toenail, cover it with a clean bandage, and leave it on for 30 minutes before rinsing off. This treatment should be used once daily for best results. Number 12. Clove oil treatment. Another natural pain-relieving remedy is clove oil treatment, which contains eugenol, a compound with antibacterial and pain-relieving properties. To use this method, soak a cotton ball in clove oil and apply it to the ingrown toenail. Leave it on for 15 to 20 minutes before rinsing off, and repeat 2 to 3 times daily. Number 13. Antibiotic ointments. Applying antibiotic ointments can help prevent infection and speed up healing. Over-the-counter ointments such as Neosporin or Polysporin should be applied to the affected area and covered with a clean bandage for protection. It is important to change the bandage regularly, especially after soaking the foot, to maintain cleanliness and aid in the healing process. Number 14. Proper footwear and nail care. In addition to these remedies, proper footwear and nail care play a crucial role in preventing ingrown toenails. Wearing properly fitted shoes with enough toe space can help prevent unnecessary pressure on the toenail. Additionally, trimming toenails straight across instead of rounding the edges can reduce the likelihood of ingrowth. Keeping feet clean and dry is also essential to minimize bacterial growth and prevent infections. Avoiding tight socks that put excessive pressure on the toes can further help maintain healthy toenails. And that's it. Now you know how to treat and prevent ingrown toenails effectively. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more health and wellness tips. Have any questions or personal experiences? Drop them in the comments below. We'd love to hear from you. Thanks for watching, and take care of your feet.